Good morning, everybody. First and foremost, I want to thank all the first responders out there and all the essential employees doing their job day in and day out so people can stay home safe and isolated. So thank you to everyone that does that. Sadly, today, we have 4 more Albany County residents that have died from the virus. 2 men in their 70s, a man in his 90s, and a woman in her 70s. Which now brings our total up to 40 people that have passed from this coronavirus. My condolences and hearts and prayers go out to the families, the 4 new families, and to the other 36. And through this difficult time, our thoughts are with you. And, again, my condolences. And it's unfortunate. As of today, too, we have gone over 1,000. We're at 1,026. Confirmed positive cases of the coronavirus, up 64 from yesterday. We have 853 people under mandatory quarantine. That's actually down 109 from yesterday. And we have 24 people under precautionary quarantine. That's up 1 from yesterday. As Dr. Whalen and I have said this, before the testing stopped, I predicted in probably 2 weeks off where we'd be at the 1,000 marker because of the testing. As we get aggressive with testing, we're going to continue to have this number climb. It has been our goal to try to get everyone tested in Albany County and the Capital District so we can get back to work, so we can open up the doors, but do it in a safe way. So it's not easy as our numbers continue to climb. It's not easy as we continue to lose people here in the county. But we have to do this in a safe manner, that before we open up businesses, before we open up more government or more jobs, it's done in a way that is going to have minimum impact on people's health. At our Shaker Place nursing home, we have 46 residents who have tested positive, including 2 residents, which is great news, 2 residents that have recovered out of that number. 23 employees who have tested positive, including 2, have fully recovered also. Little good news on a sad day of losing 4 people. We have 2,209 people who have completed quarantine, and of those, 527 tested positive for the virus have all recovered, and that's up 40 from yesterday. There are now 37 people hospitalized with a hospitalization rate of 3.68%, which is down, and we're down from 6 from yesterday that were in the hospital. We have 8 people currently in our ICU. That's down 2 from yesterday. With the testing going on at UAlbany, the testing sites with the mobile testing sites that we have going on, and as always, if you want to go to our mobile testing sites that are walk up, it's area code 518-465-4771, 465-4771. And after our first weeks of testing, we have done 495 tests, with 408 tests at our Albany sites, 87 at our Waterville site. 452 test results we have given, 46 have been positive, which is good. It means people are staying home and doing what they should be doing. The Rite Aid site's has been a huge success, and again, you have to go to riteaid.com and you got to sign up for that to go through that. But that's been really successful, and I thank the town board and Colony again, and Paul Mahan and all the legislators that were involved. Thank you. Also, a reminder of our partnership that we announced yesterday in the town of Gilliland. I want to thank Peter Barber again and Dennis Feeney and all the legislators there. It was a priority to get more testing, and that's been a priority of our office, and it was great to do this partnership. And that's going to open it up not just for the town of Gilliland, like I said yesterday, for Schenectady and for this town of New Scotland, and obviously the hill towns. So again, if you want to go to Priority 1 Urgent Care in Gilliland, you must make an appointment, area code 518-867-8040, 867-8040. Again, these are different times. The world's different, people. We all need to take a deep breath and realize that and adjust to what's going on around us. Dr. Whalen?
Good morning, everybody. So I wanted to just touch upon something the county executive just talked about, which was recovery. And we are seeing a large number of people that are recovering from COVID. We want to make sure that we get some good news out there as well. The vast majority of people, and we've discussed this from day one, and it hasn't changed significantly, 80% of people that contract COVID will have a range of illness that's either mild or asymptomatic to something like a flu-like illness. And for 20% of people, we are seeing more severe illness that may require oxygen, may require evaluation or an inpatient stay in a hospital. And for a very small percentage of people, then they will need intensive care. What we want to highlight with this good news is also the fact, though, that those that are young, that are not necessarily at high risk, are at very high risk of transmitting this to others. And that is why it's essential that they realize the importance of doing their best to prevent the spread of disease. We have gone through our demographics, and they're up online, and we still continue to see the highest group of infected individuals being those from 50 to 59, followed by 20 to 29. And these generally are individuals that are pretty healthy and may be living with others that are working that pose a risk. So it's very important for all of us to maintain social isolation measures so that we can continue to control the spread of COVID-19 in our community, and particularly importantly, avoid illness in those that are at risk. So we talk a lot about underlying health conditions and what does it mean to have an underlying health condition. This is something that we hear often. So I thought it would be helpful today to talk a little bit about who the particular risk groups are for severe illness. In general, those over 65 and those that live in nursing homes and long-term care facilities are thought to be particularly high-risk general populations. And then when you look at underlying health issues, this is for all ages, and these include things like chronic lung disease, those who have moderate to severe asthma, those with serious heart conditions, those who are immunocompromised. And the immunocompromised can take the shape of many different underlying diseases or conditions. This includes people that are getting current treatment for cancer. It includes smokers. If you smoke, you are compromising your immune system. You are compromising your ability to fight off a respiratory illness. It includes those with bone marrow or organ transplants, those with immune deficiencies, those with poorly controlled HIV and AIDS, those who are on prolonged steroid medications and other immune modulating medications. It includes people with severe obesity, and that is thought to be a BMI greater than 40. It includes people with diabetes. It includes those with chronic kidney disease, and it includes those with liver disease. So these are the groups that we are most concerned about in terms of underlying health disease. What's an important health emphasis to place on this? If you have these underlying conditions, it's important that you stay in touch with your doctor, because with all of these conditions, there is a big spectrum of illness between those who are poorly controlled and those who are well controlled. If you have an underlying health condition and you are controlling it well, and you are taking your medication, and you are following along with the doctors that you should be following along with, you're protecting yourself. This also includes other considerations towards making better health choices. So for many of us, we are now having an opportunity on pause to make changes in our health that we might not otherwise have time for. I know when I was a primary care physician in practice and discussed things like physical activity with people and healthy eating, the number one thing I would hear back is, I don't have time. I don't have time. It's too much work. I have too much else going on. So for those that now find themselves with time, please look at this time as an opportunity to look at your health, an opportunity to look at the health of the people that you love and that you live with. We've talked before about the availability of telemedicine that many practices are now adhering to. So you can reach out to your doctor. You can most likely get an appointment that you could have in your own home to ensure that your medications are appropriate to what you need and that you're doing the best of taking care of your health. Taking care of your particular health needs and making sure that your health is optimized will help protect you and will help take you out of the higher risk categories. So from a general public health perspective, what I'd like to stress today is that everyone give that some consideration. Give consideration to how you can exercise at home. There are many gym services and classes that can be streamed in your own homes. There's opportunities to exercise at home. You don't necessarily need fancy equipment. Doing that can definitely help you. So please take advantage of those opportunities. And those of you that smoke, there are opportunities through the Smokers Helpline to get the help that you need. I know it's a high stress time and it's difficult, but there's no time better than now. There's no time better than now to take these considerations on board and do what you can to optimize your health. Thank you.
Thank you, Dr. Whalen, as always. I also want to remind us, we were talking about exercise and getting out. The Albany County Rail Trail, it's a great place to go out, to walk around. Please keep your social distancing. We've been getting a lot of phone calls on that and emails. Keep your 6 feet, wear your PPE, and most importantly, please pick up after yourself. I mean, I don't know who you think is going to pick up when you throw a mask or gloves on the ground. Think of other people. Just stick it in your pockets with your mask out. We want you to stay healthy, but help us stay healthy too, so we don't have to pick up after that. And please, again, maintain your distance on the rail at all times. It's critical. But I want to thank the Mohawk Hudson Land Conservation and the volunteers that monitor the trail for us. Thank you. And also, we're letting people know that we have new bike racks throughout the rail trail now. We just installed some new bike stations if your bike breaks down, where you can fix it with some tools handy, air pumps. But most importantly, when we added that, more sites, we had to add hand sanitizer. So we have put that up there so we can keep you safe too. So when you use the equipment, you can clean your hands before and after. We put a bike rack up at Lawson's Lake. So they're on the trail. Get out, explore. I was going to tell you where they're all at, but I think you should go out and find them, and they're there for you. Please, but we want you to do it in a safe way. We want you to go out and get exercise, but we want you to do it where you're not exposing other people and you're respecting the people around you. So again, please, there's fixed stations at the trailheads along Kenwood Ave and other places, and Lawson's Lake. So the other thing I want to talk to you is before the census. The census is very important. But what's important too is that we keep getting the question, how are we going to reopen up? What things are going to look like? And that's why it was so important that I had Kevin on for economic development and talked about the Camoin study that we did. But how are we going to do that? I got a lot of questions, and I still have to talk to Mayor Kaler in the city of Cohoes. I know that they decided to stop Park Playhouse and their Cohoes Music Center. And I got a lot of questions on it. And we're trying to figure it out, because how's that going to start back up? And I got to say, it was one of the reasons why I had Tom Nardacci on here when we talked about it and talked about proctors and what's it going to look like in the future. And quite honestly, I got to figure out a 17,000 seat arena versus I think they got 2,500 seats or less in Cohoes Music Hall. it's going to be easier probably for the smaller venues to reopen and social distance and what it's going to look like going forward. But I can assure you, after people have been cooped up, they're going to want things to do, and we got to do it in the right way. They're going to want to see plays. They're going to want to go see musicals. I definitely am going to want to go to the Palace and see the SOS. You know, these are things people still want to do, but we got to figure out what it's going to look like going forward. So we're going to figure that out. I'm going to swing back around with Mayor Keeler. Haven't had an opportunity, but we got a lot of questions on that yesterday. But I can't speak for his budget and what they're doing. You know, I know it's difficult times we're all going through with the school budgets and everything else, but we have to do it in a way that we're preserving who we are. And we are about the arts, and we are about the entertainment, and we have to maintain that going forward. So the census, and that's why it's so important. With Albany County looking at facing a $30 million deficit this year, going into next year, New York State could lose an estimated $243 billion because of the coronavirus outbreak. Census is more important than ever before because it's the money we're going to get back from the federal government for the next 10 years. And, one of the things I know Mayor Sheen's done such a great job trying to get people to sign up for the census and get the message out there. We were hoping, and I know the mayor was hoping, that they were going to hit over 100,000 because there's more federal dollars that come into cities that are over 100. And unfortunately, with the school closing and this outbreak, everyone went home. City of Albany's numbers are probably going to be less than it was 10 years earlier. And that's unfortunate because that's going to have a fiscal impact on the mayor's budget for the next 10 years, as well as supervisors and other mayors, respectfully, and for the county as, county executive. So it is important to fill out your census. Please, Saratoga and Schenectady County are doing a great job. I have a little bet going with Steve McLaughlin. We're beating out Rensselaer County, but we need to continue to get that message out there. It takes 5 minutes, people. We talked about it. The slide's up. It's the 2020census.gov. Literally takes less than 5 minutes to fill it out. Please take you're home. What else you doing? You're home. I'm giving you something to do. Here's some homework for the adults out there. Count everyone in your house and fill it out. There's your homework assignment from Albany County for the day. Also, our mental health hotline's up as always, 7 days a week, 8 a.m. to 8 p.m. Area code 518-269-6634. And also the other numbers we always give out, the hotlines. And I want to remind people out there too, the governor set up a domestic violence hotline. Unfortunately, that's on the rise because people are home confined, and unfortunately this happens, and we need not for this to happen. So there's a line out there for anyone that's in that situation, and anyone that needs to get out of their house because of that situation, we will take care of you, as we always do here in Albany County, and make sure we get you into a safe environment. Also, one of the questions we did get hit with was, not to switch gears, about testing kits. I made it perfectly clear. If you don't have insurance and you don't have the money, we're paying for it. We're paying for it. So I don't want people worried about it in these tough times, whether or not they can afford to find out if they're sick. We want you to go. We want to take care of you. It's our obligation, and we want to get all people in Albany County healthy and safe. So again, thank you to everybody. Thank you to Dr. Whalen and her team as always.